When I started even here at Asante 16 years ago, quality was sort of a thin slice. They looked at data, they looked at clinical quality, but now quality is incorporated in everything we do.
When we decided that C. difficile was something we wanted to improve for our patients and for our community, we embedded it into our patient safety metric on our balance scorecard.
As an organization, we've looked at all healthcare-acquired infections and conditions that are negatively affecting the patients, and it was an easy place to know we needed to place attention there. We're here to help and to do no harm, and these are preventable, and we have a role in the transmission.
You can't improve what you can't measure, right? So we scrutinize each and every case individually. For the cases of C. difficile, we follow a template that we use, and we'll look for root causes in there and try and uncover what we can do better. We then aggregate that data and we'll communicate that out to many different levels of the organization, the individual caregivers of the organization, the medical staff, leadership, and right on up to our board.
The board really has a critical role for us here. They really help us set our vision and our mission for our organization. If they're not bought into your quality journey, you're not going to be successful. If we have something that harms the patient, we oftentimes invite the family and the patient. At first, it's very uncomfortable, but then when you see the way the clinical staff and the support staff interacts and the way they really, truly use those as learning opportunities, it becomes much more comfortable. It's not a punitive situation at all. You have to really build a culture of respect and safety.
The CDC has guidelines around the surfaces to measure and how to do that, and we weren't performing very well with that. We took a step back and said, why is that the case? Well, one of the things was we didn't have standard work for our EVS team. So we helped design standard work. It was much easier for them to get the work done and much easier for them to get the work done right. We use another really great communication tool here called a quick process observation board to get the frontline people who are doing the work, taking care of very sick patients every day, to really understand the important initiatives that we're taking on as a healthcare system.
Logs were filled out, no issues with that, so we got a green on that and passed that today.
And you tell them it's for their safety and comfort and to meet all their needs.
We've just integrated it into daily workflow, so micro level to macro level. So we have staff meetings also where we do kind of a group setting conversation around specific infections. We'll do a case review, we'll talk about what we did well and what we could have done better for the patient. When you discuss rates with staff members, that can be really challenging for them to comprehend, but if you can say one patient this month that we took care of became infected, that is more meaningful. And so the staff are huddling daily and discussing the care of the patient in a blameless environment that allows them to really help one another improve their practice.
Keep up the good work.
What I'm most proud of really in our quality journey is the way that our organization has embraced it at every level of the organization. And that's the only way you can make the kinds of changes that we've made.
I'm really proud at how collaborative we've been in this. Nobody's refrained from contributing. It's just been engagement and intentional and consistent and top of mind.
We are very fortunate in this area to have a wonderful medical staff and a wonderful caregiving staff, clinician staff, and community. In this area, we really care deeply about caring for our patients and our community, and it resonates through the medical staff. So my job is easy because people care about that.